when we created NormaLyte, there was three pillars that we kind of have always used when we practice pharmacy. We're both practicing pharmacists, we're licensed here. And one of the things was safety. So whenever we give a patient in the pharmacy a medication or something, we always worry about safety for the patient, right? We're looking at their medications, we're making sure interactions and things like that. That is of the most paramount thing for us, is to give something that will not harm them. The second one for us was efficacy. Like, does it work? Does it really work? How is it gonna work? How fast can it work? Is it gonna be good for them? You want something to be safe and you want something to actually work if you're gonna use it. And then the last thing, and it's super important, but there were a lot of times when patients would come in the pharmacy where they had a safe medication for them, something that was gonna work for them, they couldn't afford it. And that doesn't do the patient any good. And it was kind of heartbreaking at times. We couldn't give the medication to the patient due to cost, and we knew it was gonna do them wonders potentially. And that's what always bugged us. So we kind of took those aspects into when developing NormaLyte. There was a lot of thought about all three of those areas before we rolled it out.
NormaLyte follows the WHO formulation. The combination of glucose, sodium, chloride, potassium are in proportions. Even the flavored versions have one of the safest sweeteners that is being used. It is generally recognized as safe by the FDA. NormaLyte also reduces the supplemental IV requirement by 30% because it is so effectively absorbed through your oral route. You don't have to have that much IV, even in cases of severe dehydration.
Children ages 1 and up can take NormaLyte, but we always suggest that you ask your physician or your practitioner just to make sure, because everybody's a little bit different. And then also the other question is for pregnant women. Pregnant women can take it, but again, we always say take it under medical supervision.
You should always exercise caution, especially anyone with kidney disease, electrolyte imbalancing. Make sure you check with your physician.